Good morning, good afternoon, good night. I am Carolina Haylock-Loor, anesthesiologist, critical care and interventional pain physician from San Pedro Sula, Honduras. I am Director of Programs of the WFSA and Chair of the Gender Balance Ad Hoc Committee and representative of Latin America since 2012 in the same organization. I have several hats at this moment, as you heard, related to this topic, although it is a completely voluntary work. Thanks for the opportunity of sharing what the WFSA does in the world for a universal access to safe anesthesia. And I will give a quick overview of its impact in Latin America. I'll start with a brief introduction of the WFSA. The World Federation of Societies of Anaethesiolgists is an organization that unites anesthesiologists from 150 countries of the world, represent 136 national anesthesia society to bring a safe anesthesia for everyone today. The WFSA represents worldwide the anesthesia family, and for a better representation, we have 6 geographical regions in the Federation. In Latin America region, the WFSA represents 19 member societies and 60,000 anesthesiologists approximately. On the board of directors, we are 6 members. At this time, our presidents, Adrian Gelb from the United States, Wayne Morris from New Zealand, Secretary Daniela Filipescu from Romania, Treasurer David Cheng from Canada, Director of Partnership Wally Habri from Switzerland, and I am the Director of Programs. Each year, 2 members of the WFSA Council are elected with the privilege of having this year in the board Dr. Bisola Onajin Obembe from Nigeria and Dr. Christina Lundgren from South Africa. Excellent and very proactive colleagues. We also have a high-level secretariat staff, very collaborative and efficient. These are the members of the council by regions represented, including our 2 representatives from Latin America, Dr. Pedro Ibarria from Colombia and Dr. Luis Falcao from Brazil. The committee chairs are also part of the WFSA Council, and now 2 colleagues from Latin America, Dr. Mauricio Vasco from Colombia in the Constitution Committee, and I am the chair of the Gender Balance Committee. And getting down to business, this is the impact of the Gender Balance Committee teamwork in such a way that 2020 elections compared to 2016, the proportion of females involved in leadership in the WFSA, it is notorious higher, going from 29 to 43% now. And in Latin America, we have gone from having 3 females in the past term to 13 Latin American females elected in 2020, which correspond to 50% of the Latin American colleagues involved in leadership of the WFSA. And during this World Congress of Anesthesia, a higher proportion of female speakers, 38% compared to 14% in 2016. I am the Director of Programs, but what are the WFSA programs? They are covered in 4 areas: education and training, developing and strengthening the knowledge and skills of anesthesiologists, working together, promoting globally standards in anesthesiology and occupational well-being of our professional. Safety and quality aims to continuously develop international standards for a safe practice of anesthesia. And advocacy. We support and promote a focus on availability, safety, and quality of anesthesiology. In the line with WFSA position as a non-state actor in official relation with the WHO, the WFSA board have submitted the following statement under the 73rd World Health Assembly Agenda Item 11.2, Universal Health Coverage, moving together to build a healthier world. Follow-up, to the high-level meetings of the United Nations General Assembly on health issues and health-related issues. Statement delivered by Professor Adrian Gelb, President of the WFSA. And we will talk a bit of education. This busy slide is for you to see the many courses we have at the WFSA. I will highlight several of them. Safer anesthesia from education, SAFE. It has different modalities, safe obstetrics, safe pediatrics, safe OR, safe trainers. We also have safe for obstetric updating workshops and successfully piloting on mentoring programs, and also safe online, successfully piloting in Uganda and India. And now we have the digital form that we're launching in this World Congress. And also the Essential Pain Management course, the EPM, the Vital Anesthesia Simulation Training, VAST, the Primary Trauma Care, BTC, Inspire courses for clinical teaching, clinical leadership, quality improvement courses. Let's talk about the safe courses run in Latin America. We run Safe OB and Safe Peds. And we translated to Spanish all the resources it has. And this is how the Safe Obstetric courses progress in Latin America. 54 anesthesiologists trained as facilitators in Colombia in 2014 and Honduras 2016, bringing local ownership. And this is how the Safe Ped courses progress in Latin America. 66 anesthesiologists trained as facilitators in Guatemala 2017 and in Colombia 2019. Also bringing local ownership. Now let's talk about Essential Pain Management course, EPM, for education in pain. Due to an increased burden of pain in many low and middle income countries. Since 2012, that we started EPM in Latin America and Honduras, now 16 Latin American countries have run EPM with more than 50 EPM workshops, 2,000 attendees, 5 EPM trainers, 131 EPM instructors, and 6 virtual EPM courses during this pandemic. Continuing with WFSA training program SPAN, it's a fellowship training programs in 2020 that 14 countries. Of these, 5 countries are in Latin America: Mexico, Argentina, Chile, Colombia, and Brazil, with 6 fellowships in these countries. 26 hospitals in the world receive fellows. We have in total 53 fellowships, 8 clinical subspecialty, 3 non-clinical programs. Regarding online education, 3 educational modules: Anesthesia Tutorial of the Week. It's a free fortnightly, more than 430 tutorials and questionnaires in different languages and with a possibility of CME credits. Our official journal update in Anesthesia, and in the webpage, the virtual library having a COVID-19 resource hub. This hub includes the checklist for COVID-19 patient, airway management algorithm, and other relevant topics of the disease. Part of the impact of the pandemic is the burnout syndrome in health professionals and other psychoaffective disorders as anxiety, depression, panic attack, and sadly, suicide. Aware of this, the WFSA tirelessly promotes tips and practices for the occupational well-being of our health professionals, especially in this type of crisis. Also, this was our theme on World Anesthesia Day 2020. Finally, the 3 guiding pillars of the WFSA. First, the anesthesia workforce. The Global Workforce Survey updated 2020-2021. Second, the universal health coverage. the WFSA position statement on universal health coverage, and the WHO Assembly Resolution 68.15 on strengthening anesthesia and surgery as a component of universal health coverage. And third, safe anesthesia with the WHO WFSA international standards for safe practice of anesthesia. I thank you very much.